Welcome to Quick Medical Review. Today, research study design in under 5 minutes. Let's go. Buzzwords first. Randomized controlled trial gold standard for testing interventions. Cohort study follows exposed and unexposed groups over time. Case control study starts with disease and looks back at exposure. Cross-sectional study, snapshot of disease and exposure at one point in time. Meta-analysis combines data from multiple studies for greater power. Double-blinding, neither investigator nor subject knows group assignment. Institutional Review Board approves and monitors research ethics. Let's break it down. Before we talk about specific designs, let's cover the basics every study needs. First, subjects must be representative of the population the study is examining. Second, you need enough subjects to reach statistical significance. Third, all subjects must give informed consent unless the IRB grants a special exception such as in trauma patients. Fourth, proper controls must be included when testing a treatment. And fifth, patient interests always take priority over study interests. The IRB ensures this, and researchers must monitor for any risk to subjects throughout the study. Now the study designs. A randomized controlled trial or RCT is the gold standard. Subjects are randomly assigned to treatment or control groups. This minimizes confounding. A cohort study follows a group over time. You compare those exposed to a risk factor with those who are not and measure who develops disease. Cohort studies give you relative risk. A case control study works in reverse. You start with patients who have the disease and controls, who do not then look back to see who was exposed. Case control studies give you the odds ratio. A cross-sectional study is a single snapshot. You measure disease and exposure at the same time, useful for prevalence but cannot establish causation. A meta-analysis pools data from multiple studies, increasing statistical power. This is especially useful when individual studies are too small to detect a difference. However, meta-analyses are only as good as the studies they include, and publication bias can skew results. Double-blinding, where neither the investigator nor the subject knows who is in which group, is the best way to eliminate investigator bias and observational bias. Confounding variables are factors that affect both groups and can interfere with the true relationship between exposure and disease. Example RCT is the gold standard for interventional studies. Cohort studies measure relative risk. Case control studies measure odds ratio. Cross-sectional studies measure prevalence. Meta-analyses combine multiple studies but are vulnerable to publication bias. Double-blinding prevents both investigator and observational bias. That was research study design on Quick Medical Review. Study smart, not hard.